or so well hidden in the female organs that they're unnoticed. In time, even without treatment, these sores will go away. If the disease is not detected and treated in the early stages, the spirochetes remain in the body. Usually, but not always, a rash will appear on the body sometime later. This rash may appear as a few scattered spots, or it may break out over the entire body. Even without treatment, this rash too will disappear. But syphilis still remains hidden from sight. The spirochetes use the bloodstream as a highway to reach the various organs which they attack. They may cause hair to fall out, leaving unsightly patches. What is more serious, they may attack the brain. In later years, this may cause paresis, a form of insanity. The spirochetes may attack the optic nerve and cause blindness. When the central nervous system is invaded, nerves may be robbed of control over movement of the limbs. In other cases, they strike at the heart and cut off life.
But, Doctor, can you ever be completely cured?
Yes. The sooner the treatment is begun after the original infection, the better the chances for a complete and early cure. And remember, a woman has a responsibility not only to herself. An infected mother may infect her unborn child with syphilis as the spirochetes pass from the mother's bloodstream to the bloodstream of the child. If this occurs, the child may be born diseased or dead. This is called congenital syphilis. However, if the mother starts treatment before the 5th month of pregnancy and continues treatment throughout pregnancy, she has a good chance of having a normal, healthy baby. This means that when a woman thinks she may be pregnant, she should go to a doctor and have a blood test. If she has syphilis, she should start treatment at once.
Isn't there some way you can protect yourself from these things?
Yes, just as a physician protects his hands by gloves when examining a patient, so may others, by use of a suitable shield, prevent the passage of germs from one body to another.
Can you depend on it?
No, even with the most scientific care, doctors and nurses sometimes catch diseases from their patients. The only positive protection is to avoid sexual relations outside of marriage.
Well, how about gonorrhea, Doctor? Is that the same thing?
No, it's an entirely different disease. Syphilis and gonorrhea are both caused by germs, and both are caught by intimate relations. But they are not alike. As with syphilis, gonorrhea is usually contracted through sexual intercourse, and with rare exceptions, infection starts in the genital organs. This is the gonococcus, the germ that causes gonorrhea. These may attack the urinary tract or urethra and the glands near it, or the glands in the labia, or the glands in the cervix. An infected person may experience a burning sensation, especially when urinating. Frequently, a discharge may be noted. At other times, the symptoms may be so slight as to go unnoticed. Even without treatment, these symptoms may disappear. But the germs, the gonococci, will remain. Without treatment, the gonorrhea may spread to other areas. For instance, to the fallopian tubes and ovaries. This may prevent you from having a baby. Gonorrhea is one of the principal causes of sterility in women. In severe cases of infection, it may become necessary to remove many or all of these organs. If there are any questions, I'll be in my office in about a half an hour.
Very nice indeed, Doctor.
Thank you, Dr. Barnes. I'm awfully happy that you ladies could join us here.
Thank you.
And now, if you'll excuse me, I have some work back at my office. See you later.
Bye, Doctor.
Medical treatment's all very well, Dr. Barnes, but isn't it fairly expensive?
It's true that many people can't afford it, but the health department has provided free clinics. You see, the control of venereal disease is so important to everybody that we want to make the proper care available to all. Any woman who suspects she may have a venereal disease should go to her doctor or to a clinic. And if she's found to be infected, should start treatments at once and continue the treatment until her doctor tells her she is cured. Now, there's somewhere else I would like to take you. Shall we go?
I'd love to.
And this is Mrs. Parker.
How do you do, Mrs. Adams? How do you do?
Mrs. Adams has done a great deal of work with the young girls in this city and understands many of the aspects of our problem.
I think you'll find that I'm an optimist. I have worked long enough with the young people to realize that if they're given the proper opportunities and understanding guidance, most of them will develop strong characters and good moral fiber. Excuse me, Doctor. To prepare these young girls for womanhood, we must start way back in the playground of the elementary schools. And as they grow older, we must teach them personal hygiene, the value of clean bodies and clean minds. In courses in civics, we should try and make plain that diseases are not only individual health problems, but also the problems of society at large. For instance, it is very easy to convey through charts that without proper care, any contagious disease endangers the entire community. Add to these the influence of home and church, and we will give to our young people a thorough understanding of why continence is the best personal protection against venereal diseases.
You're quite right, Mrs. Adams. The only way that you can be sure, the only way that you can be completely safe from venereal diseases is to avoid sexual relations outside of marriage. If you suspect that you may have been exposed to gonorrhea or syphilis, go at once to a licensed doctor of medicine. If you are found to be infected, start treatment immediately and remain under the doctor's care until he tells you that you're cured. Learn how your body functions. Take every precaution against the spread of the disease in yourself and to others. When you find you're going to have a baby, go to your doctor and ask him to make a blood test for syphilis. Early treatment will save your baby from being born diseased or dead. If you can't afford a private doctor, call your health department and free treatment will be provided. Remember, your health and the health of your children depends on you.